Well, thank you, Maddie. And everyone, thank you so much for joining our press conference today. I especially want to thank Senator Murkowski and Congresswoman Jayapal. We have been working together on this bill for years now, and I'm so grateful for their partnership on this really important issue. And I want to thank Leah Griffin, a constituent of mine who you will hear from in a minute, for her incredible bravery in sharing her experience surviving sexual assault and struggling to get care. For so many survivors of sexual assault like Leah, it's an extremely difficult choice to disclose their assault and seek justice. And critical to their ability to hold perpetrators accountable is having access to a sexual assault forensic examination, which includes a rape kit. During this unimaginably difficult time, survivors deserve to be able to go to a hospital and get compassionate, experienced care from a trained nurse and a commitment to helping them get justice. But for too many survivors, that is not the case. And it certainly was not the case for Leah. When Leah told me about her experience of surviving sexual assault and being turned away from a hospital when it was unable to administer a rape kit, I was appalled that someone would go to seek care and justice and be told, not here, or try somewhere else. And for Leah, that ultimately contributed to prosecutors declining to file criminal charges. Unfortunately, her case is not unique because hospitals do not always have appropriately trained staff or resources on site, and survivors across the country are unable to get the care they need to heal, and the forensic examination critical to their ability to seek justice. And this problem has only gotten worse during this pandemic. Sexual assault is a public health care crisis, and we need to be doing everything we can to support survivors on the path to recovery and help them obtain justice. Our bill, the Bipartisan Survivors Access to Supportive Care Act, is a common sense step to develop national standards of care for survivors of sexual assault, strengthen the sexual assault examiner workforce, and expand access to sexual assault examination services, including to rural and tribal communities and for higher education students. We've got to pass this bill without any further delay because change is so urgently needed, and survivors like Leah have already waited far too long. In fact, Leah's story led us to first introduce this bill back in 2016, and it is thanks to her tireless advocacy and her willingness to tell her story that we've made progress in Washington State on this issue and continue to build support here in Congress. Leah, I am so grateful for everything you have done on behalf of sexual assault survivors, and I'm honored you could join us today. Thank you. I will turn it over to you for your comments.
Thank you, Senator, and I appreciate all the work that you and Senator Murkowski and Congresswoman Jayapal have done on this issue. When I was assaulted in 2014, I did what I thought I was supposed to do. I went to the closest emergency room, I went in, told them what had happened, and they shrugged their shoulders and said, "We don't do rape kits here." So I left and went to a second ER hours later, but that delay in care caused problems in my case. And this only began a series of catastrophic failures that eventually led me to Senator Murray. In our work, we found that only 1 in 5 hospitals in the United States have 24-hour access to sexual assault nurse examiners. This means that survivors are crossing state lines or driving hundreds of miles in order to access the care that they need. And when we place these barriers in place, survivors are not only being denied access to justice, but they're also being denied access to healthcare like STI prevention and pregnancy prevention and other equalizers and safeguards. SASCA is the first step in solving this problem, to identify how bad the problem is, to train more nurses in an incredibly high burnout field, and to make sure that a survivor's access to healthcare and justice does not depend on their zip code. So I'd like to thank everybody and turn it over to Senator Murkowski.
Leah, thank you. And thank you for your leadership throughout. Senator Murray, thank you for what you have done. I have appreciated working with you, partnering on this since we first introduced back in 2018. And I heard your story for the first time, Leah. And to Congresswoman Jayapal, thank you also for your leadership on this. I think what you have outlined, Senator Murray, in terms of the actual construct of this legislation, the effort to expand the network of sane nurses across the country is just so key, so critical. We recognize that there's a shortage of individuals who are certified to perform these medical forensic exams, the rape kits, and making sure that we are able to respond in the time of need, in the time of crisis, must be a priority. Leah, you have outlined your situation in Alaska. I hear stories that just rattle you to the very core. You can imagine after being brutally assaulted, you want to seek help, but there's no place to go. There's no police presence in your community. There's no public safety official. There is no domestic violence shelter that you can seek refuge in. Your community is a small one, say less than 100 people. So you can't even escape your perpetrator. And yet when you finally are able to make the call to help and try to be transported to the nearest hub for a rape kit, you've got to fly by plane, but bad weather sets in. It prevents you from getting to you. And once again, you are alone, you're trapped, and you're basically instructed to wait, to sit and wait in the clothes that you were assaulted in. They tell you try not to use the restroom in order to preserve the evidence. And this is not what I'm sharing with you is not just some imaginary fictitious story. This is the story. This is the nightmare for far too many Alaskan women, particularly in the rural parts of our state. We've got over 80% of our communities that are not accessible by road. So literally the only way in and only way out is by airplane. And when weather comes in, again, your ability to seek these essential services, to be able to access a rape kit, can seem almost impossible. And so this is what helped to spark my interest in helping with Senator Murray as we introduce this bipartisan bill, the Survivors Access to Supportive Care Act. But the goal, again, to address the limited availability of training and the lack of access to medical forensic exams in both urban areas and in rural communities. I think people may understand a little bit when access is limited in small communities, but when you're in an urban center, that's inexcusable. So our legislation will help ensure that all survivors, no matter their location, will have access to the only exam that can assist them in their journey for justice. We also create a national task force that will help to establish standards for a federal training program. This program will be open to nurses, physicians, nurse practitioners, nurse midwives, physician's assistants, and certified nurse specialists, as well as community health aides and practitioners like we have in Alaska. Alaska Native women face drastically higher rates of rape and sexual assault. During the COVID-19 pandemic, we have seen an unprecedented increase in domestic violence and sexual assault, specifically in our rural communities. So our bill provides training grants to entities that serve rural and tribal communities, with 15% of the funding allocated for these grants that are set aside for tribes and tribal organizations. I think we recognize that after a year of stay-at-home orders, we have a greater need than ever for this legislation. So I thank all those who have been working to support this legislation already, from healthcare providers to survivors and community members that are acting as advocates. I'm going to finish with a quote from a young Alaskan survivor who said, "There is strength found in survival unlike any other." SASCA, I think, is one of those steps needed to support the brave individuals who deserve every opportunity for comprehensive healthcare and justice. I think it sends a clear message to every nurse, to every advocate, and every survivor that we must and we will do better. So thank you all for what you are doing to help advance this very important initiative. And with that, I will turn to Congresswoman Jayapal.
Thank you so much, Senator Murkowski, for those really powerful words. And I'm so glad to be alongside you and my wonderful senior Senator Patty Murray, who has been such a champion on this issue for a long time as we reintroduce this urgent and frankly overdue legislation, the Bipartisan and Bicameral Survivors Access to Supportive Care Act, or SASCA. Leah, I am so grateful to you. I met you back in 2015 when I was in the state Senate, and we were part of a bipartisan group of 4 to introduce a bill on rape kits. And you testified before us, actually even before the legislation was introduced. And we were so moved by your testimony, but moved by your advocacy, moved by the need that you expressed on so many levels to really address the gap in resources. And I can say, Leah, that this bill would not be where it is if it weren't for your work and your advocacy. And certainly in Washington State, when we passed that first rape kit bill, that was because of you and other survivors who came forward. So I am incredibly grateful to you. As of now, as you've heard, there is still no federal program that exists solely to expand and guarantee healthcare access for survivors of sexual assault. And on top of that, HHS does not currently oversee any national standard protocol for sexual assault examiners. That unacceptable gap in resources and care is happening during a pandemic that has exacerbated the need for supportive health services. It is way past time to address the gaps that have left too many survivors like Leah without the ability to get the justice and the care that they deserve. SASCA addresses these gaps in several key ways. First, our legislation provides $2 million per year in state level funding to better address the gaps in care and services for providers while seeking to address them all together. Second, as Senator Murkowski said, the bill develops national standards of care for survivors to ensure more equitable access across our country. And we do this by directing HHS to establish a national training program on sexual assault examination protocols. Third, SASCA makes it easier for healthcare providers to access training so that they can better provide care to survivors. And it establishes a pilot program to expand exam training and services, as well as a new resource center to support access to examinations and encourage training for personnel. And finally, as we work to end sexual assault on college campuses, this legislation increases access for students and supports the needs of students who are survivors. I know that we are all committed to ending gender-based violence and sexual assault across America. As we continue that urgent work, SASCA increases access to resources while finally establishing national standards of care. It is inspired by the voices of survivors everywhere. Survivors like Leah and those that we are hearing from today. Let's pass this necessary legislation. And now I'd like to introduce Jennifer Pierce-Weeks, who is the Executive Director of the International Association of Forensic Nurses. Nurses across America have been critical partners in our work to create this legislation and to ensure every person has the care and the resources they need. Thanks for being with us, Jennifer. The floor is yours.
Thanks very much and good morning. Senator Murray, Senator Murkowski, Congresswoman Jayapal, thank you for the opportunity to speak today. As you said, I'm Jennifer Pierce-Weeks, the Chief Executive Officer for the International Association of Forensic Nurses. With more than 6,000 members from 26 countries, we as an organization have a mission to provide leadership in forensic nursing practice by developing, promoting, and disseminating information globally about forensic nursing science. In addition to being a membership organization, we establish and promote standards of practice for forensic nurses, provide substantive education in the field, and offer board certification in both pediatric and adult sexual assault nurse examiner practice. We also participate in and support research initiatives. While many people believe that sexual assault is our only focus, IFN provides considerable training and technical assistance on intimate partner violence and strangulation, child and elder maltreatment, human trafficking, accidental and non-accidental trauma, and forensic nursing program development, sustainability, and expansion. And I think, as many of you are aware, there's a lot of overlapping issues with sexual assault and some of these other violence-related health problems. Our work is guided and informed by our commitment to ensuring access to evidence-based, trauma-informed, patient-centered forensic nursing care. So for that reason and everything outlined by all of you, we strongly support the SASCA legislation introduced by Senator Murray and Senator Murkowski. We believe this bill will expand access to qualified examiner services and help strengthen national standards of care for survivors of sexual assault. SASCA would provide guidance and support to states and to hospitals providing sexual assault examination services and treatment to survivors. So thank you again for inviting us here today, and thank you so much for your work on this very important legislation.
Great, thank you. And Tara?
Hi, thank you, Senator Murray, Senator Murkowski, Congresswoman Jayapal, for allowing me to speak for a moment today. I'm happy to be here as a constituent of Alaska to support the Survivors Access to Supportive Care Act. Over the past 24 years of working as a forensic nurse in Alaska, I've been one of the primary medical trainers for our sexual assault examiner programs, hospitals, and clinics throughout the state. We have approximately 15 forensic nursing or sexual assault examiner programs in Alaska that are in various stages of operation. Many of these programs were initially started in the mid to late 1990s and early 2000s. However, over the years, these programs have had to close and reopen many times and still are currently in various stages of operation. It is tremendously difficult to sustain continuously operational sexual assault examiner programs in Alaska, particularly in our rural communities off the road system. One of the major obstacles to sustaining a consistently functioning sexual assault program is the lack of specially trained nurses and other healthcare providers to do this work. The limited number of healthcare providers who are trained and specialize in the sexual assault medical forensic exams impacts the ability for hospitals and clinics throughout our state to provide access to these services in their local communities. So by creating a healthcare-driven national sexual assault training and continuing education opportunity for our hospitals and healthcare providers, and having a healthcare resource center that's available to them, the Survivors Access to Supportive Care Act would help increase patient access to sexual assault medical forensic examinations by trained, specialized healthcare providers and nurses in our Alaska communities. Alaska has record-breaking rates of sexual violence. And if patients can access comprehensive sexual assault care in their local community, instead of having to fly to another town or travel many miles to access these services, it would decrease this significant reporting barrier and improve Alaska's healthcare response to patients who have been sexually assaulted in our state. So I appreciate all the work that you're doing to reintroduce the Survivors Access to Supportive Care Act, and I strongly support it on behalf of myself and all of the forensic nurses who are doing this work and have done this work in the state of Alaska.
Thank you, Tara. Thank you, all of you. I just feel like this is our year. This is an issue. It's bipartisan. We will pursue every avenue to get this done, and we owe it to women and men across the country who are survivors of sexual assault to make sure that when they seek care, there's help there for them and justice. So thank you all to all of our speakers, and we will turn it over to Maddie for any questions from all of you.